Hello, I'm Charlotte Davies. I'm one of the emergency medicine doctors, and I'm going to talk to you about mandatory training, CPD, appraisal, and the CESR route. At first glance, all of these might seem exactly the same, but there's a few subtle differences between the few of them, and talking about them now, we hope will help you settle into the United Kingdom. The first thing to talk about is mandatory training, and your mandatory training is compulsory, which means that you absolutely must do it. You should be doing this in paid or work time, and the amount of mandatory training you do will be specific to your trust and specific to your role. Your trust will have a list of what you need to do, and hopefully they'll share this with you at an early point. Our trust has a long, lengthy list of the mandatory training that each new starter is expected to do, and these are expected to be done in your own time. But if you need to do them before you come to the UK, that's absolutely fine, but make sure you're aware of the remuneration package before you do them. So most places will offer you some time back in lieu for the time you've spent, but they might offer you financial reimbursement. But whatever it is, find out before you start the work. The next thing is CPD, which you'll already be used to because this is an integral part of being a good doctor. This should be completed in your own time or work time, depending on the contract that you've agreed before you've started. You need to make sure you log your CPD on a portfolio of some sort, and this might be a paper portfolio that you keep and lug around with you, or it might be an electronic portfolio. One of the portfolios we use is called Horus, and this is the one that the foundation doctors use, and your medical education centre can probably set you up with a Horus account for free. Our trust uses a system called SARD for their appraisals, and this again has a CPD logging facility. There are other portfolios available. Most of these will be specific to your specialty and they will come with a cost. They're free with your membership fee, but you still need to pay the membership fee. So generally, a self-designed portfolio system or something like Horus is best unless you've already decided that you're definitely going to go on to a specific specialty training route. You need to make sure that you log your CPD according to the requirements of your specialty. So for me, emergency medicine, they've got loads of guidelines. One of them says that I can only have 30% of my CPD coming from publications. So make sure you read all the requirements to make sure that what you're doing is absolutely right. You need at least 50 points a year, and this will be reviewed at your annual appraisal. The GMC require at least 250 points every 5 years for you to be able to complete your revalidation. It's normally that you get 1 point for every hour of CPD that you do, and you need to make sure you write your summary down. But this is absolutely essential for your revalidation. It's not an option, it's absolutely vital that you do it. When you're logging your CPD, you need to split it into internal and external points. So there's some examples of internal points, but these will be things that provide you education from within your department, so attending meetings, teaching other people. Your external points will be things that you do outside of your trust, so things like courses, conferences and e-learning modules. And to make your CPD log really good, it's really helpful to have a quick reflection about what you learnt and how your practice has changed from that particular bit of CPD. There are lots of places that you can get free CPD from. Doctors.net will give you a free account if you've got a GMC number. E-Learning for Health has got so many modules you'd never complete them, including the script modules, which are all about safer prescribing. Your Royal College, like the Royal College of Emergency Medicine, will almost certainly have loads of CPD, much of which will probably be free, but some of it might be a member-only bonus. One of the other ways you can log your CPD is by doing workplace-based assessments, and these help evidence the knowledge that you need for your appraisal. Completing these will be essential if you want to go on to a CESR application, but each specialty has its own different assessments, which means there's too many to talk about each individual assessment here, and then send them the supporting paperwork. The paperwork might be a paper form, maybe you've downloaded one, or maybe you've created your own. It might be an electronic form that you've created yourself using an electronic tool. Or it might be that you've got access to a portfolio like Horus or your specialty portfolio, and you document it using this. There's lots of different assessments. The most common ones are the clinical ones, the DOPS, CBD and mini-KEX, which will be focused on a clinical encounter. There's a few more non-clinical ones or ones that lump clinical cases together. So things like the ACAT and the ESLI look about how you manage your workload as much as how you manage the clinical presentation. There's then assessments like an MSG or a PSG or a TAB, which look more about how you are as a person and your communication and your teamwork. But getting a mix of these will be really, really important. You will also be eligible for study leave, and as a doctor not in training, the amount of study leave time and reimbursement that you get depends on your trust policy and your departmental policy. But there is some differential attainment funding available. Your trust will have a differential attainment champion, and it's worth finding out who they are early on. Differential attainment is essentially the name given to where one group of people with a protected characteristic, like ethnicity, perform worse than another group without that protected characteristic. Because you're all international medical graduates, your ethnicity will be different to a UK graduate, so you are very eligible for this funding, but find out about it and ask about it. Your annual appraisal is a requirement of GMC registration. It's absolutely essential that you keep up to date with these. It's not optional, and without it you won't maintain your GMC registration. The Trust will allocate you an appraiser who will just have a nice friendly chat with you really, set a PDP for the next year, discuss your well-being and make sure that you're able to evidence all of the domains of GMC good practice. So the 4 main domains of the GMC good practice guidelines, the first one is knowledge, and you'll evidence this through your CPD diary. Safety and quality is looking at things like quality improvement and audit projects. And then communication and maintaining trust is again looking at patient and colleague feedback and evidencing that. But if you speak to your appraiser early, they'll help guide you in the right direction. To prevent appraisal nightmares, it's important that you speak to the appraisal team early on because the requirements will vary depending on your individual background. At our trust, we make sure that all new starters have an appraisal light within their first 3 months of starting. And this is a bit early, but it really means that you're set on the right track for the next year and your appraisal isn't frightening because you've got everything ready that you need to be. But find out what happens in your trust. If you want to enter the specialist register, you might like to go into formal training, or you might like to use the CESR route, which is an optional route to enter the specialist register. How you do this is specialty specific, so if you're thinking about it, liaise with your specialty tutor and the Director of Medical Education early to make sure that you're heading along the right track. Again, your specialty will have some advice available. Make sure you access it and speak to the people that can help you. There are plenty of options available to you for careers planning. Your trust will have some trust-specific options as well as these options that are available for everybody. That's a whistle-stop tour of mandatory training, CPD, appraisal and the CESR route. If you have any more questions, your medical education team and the appraisal team will be delighted to help answer them. Just don't leave it to the last minute. Thank you very much.